chances are you have seen these celebrities on TV, these social media ads, or even letters in the mail about these plans that cost you zero money and promise you all these extra benefits. What's up, friends? Rob here, the Medicare Minister with Agape Insurance in North Mississippi. Well, today I'm going to talk to you about what is called a dual special needs plan, or D-SNP for short. And if you're on Medicare and Medicaid, how you can qualify for it, because it could seriously mess up your benefits if you get on the wrong D-SNP plan. So let's first start with the good. Now, the good part about these D-SNP plans, or dual eligible plans, is that they do provide thousands of dollars in extra benefits per year if you're on both Medicare and Medicaid, and it's not any additional cost to you, the Medicare Medicaid beneficiary. Some of these benefits are dental, vision, hearing. The most popular benefit is the grocery benefit that you could qualify for, along with the flex utility card that you could utilize to help you with some miscellaneous cost, as well as towards your utilities, additional benefits such as transportation, foot care, and chiropractic care, and more. Now, I must bring this up real quickly. The level of Medicaid is going to determine which plan you can qualify for and how many benefits that will unlock for you, the beneficiary. If there was an easy way for me to communicate what these plans are to you, I would simply say it this way. It takes your Medicare and your Medicaid and puts it on steroids. So this is the good part, is that you can get all these extra benefits at no cost to you. Now, if you don't know what level of Medicaid you have, or maybe you're thinking, hey, I qualify for Medicaid, but I don't even know how to get that process started on how I would apply for it, and someone to help me see if I even do qualify for it, then we'll put our number on the screen, and either myself or one of our seasoned advisors would be more than happy to help you determine what level of Medicaid you have, or just help you apply for the first time to get you these extra benefits that could possibly be a big benefit for you. And we do that at no cost or no obligation to you. Now, one quick side note that I need to make here is that you are never stuck on a specific plan. So if you do happen to enroll or sign up for one of these D-SNP plans, then Medicare does give you the opportunity to change that plan once per quarter. And this can be a really good thing for you, especially if you're not happy with that plan. Another thing that I want to mention to you today is you may have a chronic condition, right? Such as maybe you've been diagnosed with HIV or AIDS, or you've had a stroke, or end-stage renal disease, or some neurologic disorder, dementia, diabetes, cancer, and more. But if you have one of these chronic conditions, there is actually a specific plan called a C-SNP, a chronic special needs plan, that will be tailored specifically to help you with that chronic condition. So that's another thing that you need to be aware of. And that could be a good thing for you, because you could get access to all these extra benefits. Because what I have found in my experience is that those that are on Medicare and Medicaid are on very low incomes, and they are looking for as much help as that they can get. So that's the good part of these D-SNP plans. Now let's talk about the bad part. And the bad part, or potentially bad part, is if you do not check all of your doctors, all of your providers. This even includes durable medical equipments, where you may get wheelchairs or nebulizers or CPAPs and other accessories that you may need to help you with your health care and be able to function daily. And so you definitely need to make sure that you check all of these providers. This is why it's very important that you get with a seasoned advisor who can put all that information into the system to make sure. Why? Because just because you're getting that covered now, if you're on Medicare and Medicaid, doesn't mean that specific carrier that offers you this plan is going to have all of those providers in their network. And if you didn't know this already, their network trumps the Medicare Medicaid network. You need to make sure that all of your providers are in this particular carrier's network. Carriers, some of the big ones that I'm thinking of off the top of my head are like Aetna, Blue Cross, United Healthcare, or Humana, to name just a few. You definitely want to make sure that they match. So this could be a bad thing, because if you get put on a plan and they didn't check your doctors, then it could result in extra out-of-pocket costs for you, the Medicare Medicaid beneficiary. The other potential bad thing that could happen here is if they do not check, or if you do not check all of your drugs to make sure that they are in the formulary of that specific carrier that you enroll with. Once again, just like your medical providers, right? This is very important, because it could result in extra cost out of your pocket. And this can be a really big deal, especially if you're on an extremely limited income. If you're a Medicare Medicaid beneficiary, this could be a sticker shock to you. This could be a very frustrating and very overwhelming if this happens to you. So I cannot stress these two things enough. Check all of your providers and check all of your medicines. Now, before I give you the downright ugly part of being enrolled in a Medicare, a Medicaid plan, a D-SNP plan, if you are getting value out of this video, please take a moment to like, comment, subscribe. This just helps us help more Medicare, Medicaid beneficiaries like yourself. All right, so let's finish this video out by talking about the ugly. The ugly part of this is, unfortunately, there are scammers out there, call centers out there that target individuals like yourself and wind up putting them on plans where their doctors and their medicines are not covered. And where it gets really ugly is you are stuck on that plan, in some cases for up to a quarter, for another 3 months. You're stuck on that plan unless you file some type of grievance with Medicare and that specific carrier. But even then, you are stuck on that plan till the first of the following month. So let me give you a hypothetical scenario. Let's say you signed up for a plan that is starting January the 1st. And unfortunately, this scammer out there, this bad agent out there, put you on a plan and didn't do their due diligence to make sure that all your carriers, all of your medicines are covered in that specific formulary, then you're stuck on that plan till the first of the following month. But you would have to file a grievance with that company and with Medicare to get off of it. So just because you filed the grievance on January the 2nd doesn't mean you're going to get immediately kicked off that plan. So this is very, very important. This is where it gets ugly, or one of the ugly parts of being on a dual special needs plan. The second thing that I'll make a mention in this particular category is that you can be put on a worse plan, or a plan that doesn't unlock all the benefits that you're entitled to. Let me give you an example. I've seen some call centers, I've seen some scammers out there take you from a PPO plan and put you on an HMO plan. If you don't know the difference, the short version is an HMO plan is more restrictive than a PPO plan. So once again, this could result in you having to pay out-of-pocket expense or being denied altogether because your doctor is not in that carrier's network. The other thing is, I've seen where people are entitled to way more benefits, but because that agent didn't do their due diligence, they're put on a partial dual eligible plan versus a full benefit plan. And that could result in you, the Medicare Medicaid beneficiary, losing those extra benefits and those not being unlocked for you. So I cannot stress this enough to make sure that you get with a seasoned advisor. Once again, I'll put our number on the screen. Myself or one of our agents would be more than happy to help you. No cost, no obligation to you. We work in most states, but if we do not work in your state, we have a trusted network of seasoned advisors that we would be more than happy to connect you with to make sure you get this enrollment right the first time. I pray that you got tons of value out of this video today, and God bless you guys, and we'll see you on the next video.